All right, let's jump into this deep dive. We're cracking open your nursing school lecture notes today, all about the integumentary system.
Ooh, the integumentary system.
So much more than just skin, you know?
Absolutely.
Like, I had this weird mole a while back,
Uh-huh.
and it got me thinking, like, what's actually going on beneath the surface?
Yeah, that's what's fascinating about the integumentary system, right? It's a window into our overall health.
Totally.
And for nurses, it's a crucial part of patient assessment
Makes sense.
because it can reveal so much about what's happening inside.
Okay, so before we get to my mole derma,
Okay?
let's start with the basics.
The basics. Well, we can think of the skin as having two main layers. The epidermis
Okay.
and the dermis. The epidermis is that tough outer layer, like a barrier protecting us from the environment.
Like a shield, fighting off all those germs and sun rays and everything.
Exactly. And then underneath that, you've got the dermis where all the action happens.
Ooh, the action.
Packed with blood vessels, nerves, hair follicles, sweat glands. It's a busy place.
So when nurses are examining this skin, what are they looking for?
Well, they're paying close attention to any changes, especially in color. Skin discoloration can be a major clue.
Yeah, color. You know, I've always noticed how some newborns have that kind of yellowish tinge.
Right. That's jaundice. And while it's common in newborns, it can also be a sign of serious conditions in adults, like liver problems.
Oh, really?
Yeah, when there's a buildup of bilirubin in the blood.
Wow, I had no idea. So yellow skin, not always a good sign.
Not always.
Okay, what other color changes should we be aware of?
Well, redness or erythema is another one.
Okay.
I mean, we all know what a sunburn looks like, right?
Yeah, ouch.
That's erythema caused by increased blood flow to the area.
Okay.
But redness can also be a sign of allergies, infections, or even reactions to medications.
So it's like your skin's way of saying, hey, something's up.
Exactly. And then there's pallor, which is the opposite of erythema. Paleness usually indicates decreased blood flow, maybe anemia.
So if you're looking a little pale, might need to get those iron levels checked.
Right. And then there's that bluish discoloration, cyanosis.
Oh, yeah, cyanosis.
That's when the blood isn't carrying enough oxygen.
Okay.
Could be from respiratory problems or heart issues.
That's a big warning sign then, for sure.
Yeah, definitely not something to ignore.
So we've got yellow for jaundice, red for erythema, pale for pallor, and blue for cyanosis.
Mm-hmm.
It's like a color-coded warning system on our bodies.
I like that. And beyond color, nurses are also looking for any unusual marks or growths.
Oh, right. The notes mention all these different types of, what are they called, lesions?
Lesions, yeah.
Macules, papules, nodules. So many.
It can seem overwhelming, but it's actually pretty logical once you break it down.
Okay, let's break it down then.
So first you've got primary lesions, which are the initial changes, and then secondary lesions.
Yeah.
Those develop from the primary ones, or from things like scratching.
So, like, if I get a mosquito bite, that's a primary lesion.
Yeah.
But if I scratch it and it scabs over, that's secondary.
Exactly.
Okay, I'm following so far. Let's dive into those primary lesions then.
Okay. You mentioned macules before. Those are flat, discolored spots, like freckles or some moles.
Oh, so those are macules.
Yep. Then you've got papules, which are raised lesions, less than 1 centimeter across.
So macules are flat, papules are raised.
Exactly.
What comes after papules?
Nodules.
Nodules.
Similar to papules, but larger, deeper into the skin.
Okay, so we're going from flat to raised to deeper. Interesting. What about those itchy bumps, like from allergies?
Ah, you're thinking of wheals.
Wheals.
Superficial, raised, often itchy.
Hives.
Exactly. Or mosquito bites.
Right. So we've got macules, papules, nodules, and wheals.
And we're just getting started.
There's more.
Oh, yeah. Next up are vesicles, those small fluid-filled blisters you get with things like chicken pox.
Those are so tempting to pop.
I know, right? And then there are pustules, which are similar to vesicles, but filled with...
Okay, not as much fun to pop those ones.
Definitely not. And finally, we have cysts. These are encapsulated, fluid-filled cavities that can form within the skin.
Those sound serious.
They can be. Sometimes they need to be drained by a doctor.
Yikes. Okay, so we've got macules, papules, nodules, wheals, vessels, pustules, and cysts.
That's a lot, right?
That's just the primary lesions. My brain is already full.
Maybe we should take a break here and come back to secondary lesions next time.
Yeah, good idea. Join us for part 2 as we keep exploring those fascinating skin changes. Welcome back to our deep dive into the integumentary system.
Back for more skin talk.
Oh, yeah. Last time we left off with primary skin lesions, those initial changes, like a mosquito bite or chicken pox blisters, that sort of thing. And now it's time for round 2.
Round two.
Secondary lesions.
The aftermath.
So, like, if I scratch that mosquito bite and it scabs over...
That's a perfect example.
That's a secondary lesion, right?
Yeah, that dried up exudate is called a crust.
A crust. It's official.
Yeah.
I'm never calling it a scab again.
It's got a much more sophisticated ring to it, right?
It does. And the notes mention that crust can be all sorts of colors, depending on the fluid drying up.
Oh, yeah. You might see anything from red-brown to yellow, even honey-colored.
Honey-colored crusts. Okay, this is getting a little too visual for me.
Sorry. Maybe we should move on to something a little less gooey.
Yeah, let's talk about something else. Like, what about those flaky patches we get, especially in winter? Just dry skin, right?
Well, those are called scales, and they can be a sign of dry skin, but also eczema or even fungal infections.
Scales. Okay, so crusts for scabs, scales for flaky skin. What about those deep cracks you get, like on your heels?
Ouch, those are fissures.
Fissures, yeah, those are painful.
They are, and they extend into the dermis, the deeper layer of the skin.
So they're not just superficial then?
Nope.
And sometimes, if I pick at a blister too much, it turns into this raw, open sore.
That would be an erosion.
Erosion.
It's like a shallow wound where the top layer of skin is gone.
Okay, erosions are shallow, fissures are deep cracks. And I'm guessing ulcers are even worse.
Ulcers go even deeper, and they often leave a scar.
So we've got crusts, scales, fissures, erosions, and ulcers.
The magnificent 5 of secondary lesions.
I feel like I'm learning a whole new vocabulary.
You are, and it's important because all these different types of lesions can tell us something about what's happening with the skin.
It's like our skin is trying to communicate with us.
Exactly. Now, remember how we talked about the importance of color changes in the skin?
Mm-hmm.
Well, the way lesions are arranged can also be a clue.
Oh, right. The notes use all these terms like annular, confluent, discrete.
It's like a secret code.
Help me crack the code then. What does annular mean?
Annular means ring-shaped. Think of ringworm.
Oh, like a bullseye. Okay, annular, got it. What about confluent?
Confluent means the lesions run together.
They're all merging.
Yeah, like hives.
Okay, and then discrete lesions are the opposite, right? They stay separate.
Right, like individual little dots.
Got it. So annular is ring-shaped, confluent is merged, discrete is separate. What about grouped?
Grouped lesions appear in clusters.
Like they're hanging out together.
Exactly. You often see that with contact dermatitis.
Okay, so we've got rings, mergers, solo acts, and group gatherings.
You're getting the hang of it?
I think so. Are there any other configurations I should know about?
There are a few more, like gyrate, which are wavy,
Wavy, good.
and target lesions, which have concentric rings, like a bullseye, but with multiple rings.
Okay, I'm not sure I'll remember all of those.
Is it a lot to take in?
But I'll definitely be keeping an eye out for any suspicious patterns on my skin from now on.
And if you see anything that concerns you, always check with a doctor.
Absolutely. Now, the notes also mentioned lesions caused by trauma or abuse.
Yeah, that's a difficult topic.
It is.
But as nurses, we're often in a position to recognize patterns of injury that might suggest abuse.
That's a heavy responsibility.
It is, but we're trained to look for those signs.
So if a nurse suspects abuse, what happens next?
Every hospital has protocols for reporting it.
Okay.
We have a legal and ethical obligation to protect vulnerable individuals.
That's good to know. All right, we've covered a lot of ground with recognizing and classifying skin lesions.
We have.
But what about treatment? The notes mention everything from medications to surgery.
It really depends on the specific condition.
Okay.
Some common treatments are phototherapy, radiation therapy, laser technology.
Wow, there's a whole arsenal of tools.
There is. And then there are medications like antibiotics, corticosteroids, antihistamines.
It's amazing how many different approaches there are.
It is. But of course, the best approach is always prevention.
Right, especially when it comes to something like sun damage.
Absolutely.
Huh.
Protecting your skin from the sun is crucial.
So sunscreen every day, rain or shine.
Rain or shine.
What are some other tips for keeping our skin healthy?
Staying hydrated is key.
Drink that water.
And a healthy diet with lots of fruits and veggies.
Makes sense. Okay, so hydrate, eat well, moisturize, wear sunscreen.
The holy grail of skincare.
Got it. Now, I'm curious. We've talked a lot about skin, but the integumentary system also includes our hair and nails, right?
You're right. It does.
And they can tell us about our health, too.
Oh, absolutely.
Spill the tea. What kind of hair and nail problems should we be on the lookout for?
Well, let's see. The notes mention things like seborrheic dermatitis.
Which is dandruff.
Oh, dandruff. And then there's tinea capitis.
That's a fungal infection of the scalp.
Okay.
And alopecia areata, which causes patchy hair loss.
Patchy hair loss. That sounds a bit scary.
It can be distressing, yeah.
Is it common? It's more common than you might think.
Wow. And what about nails? What kind of nail problems can signal health issues?
One of the most striking is clubbing.
Clubbing.
Where the fingertips enlarge and the nails curve downward.
I think I've seen pictures of that.
It can be a sign of lung or heart problems.
Okay, that's definitely something I'd want to get checked out.
For sure. There are a few other nail conditions we could talk about.
Oh, there are more?
Yeah, maybe we should save those for next time, though.
Good idea. My brain is officially full. Join us for the final part of our deep dive as we wrap up those fascinating hair and nail conditions. All right, we're back for the final part of our Integumentary system deep dives.
The grand finale.
We've covered so much already.
Yeah, we have.
Skin discoloration, those lesions.
It's a crazy name.
But we left off with a bit of a cliffhanger.
A cliffhanger.
All about the secrets our hair and nails can reveal about our health.
Ah, yes, those hidden messages.
So last time you mentioned a couple of hair conditions that really piqued my interest, like alopecia areata, which causes that patchy hair loss.
Right, alopecia areata.
Yeah. What causes that again?
It's an autoimmune disorder.
Okay.
The body's own immune system attacks the hair follicles.
Wow, that's wild.
It is, and it can be really tough for people who experience it.
I bet. And you also mentioned trichotillomania.
Ah, yes, the hair pulling disorder.
That one's a mental health condition, right?
It is.
And it can actually lead to hair loss, too.
It can, yeah, from the repeated pulling.
It just goes to show how interconnected our mind and body really are.
Absolutely.
Okay, so we've got alopecia areata, trichotillomania. Any other hair mysteries we should explore?
Well, I think we've all encountered head lice at some point, right?
Don't run me.
Not the most pleasant experience.
Those things are like tiny ninjas.
They are persistent, that's for sure.
Okay, let's move on to those nail clues you promised.
Nail clues.
We already talked about clubbing, which could be a sign of heart or lung problems.
Right, clubbing is a big one.
But you said there were more?
Oh, yeah, there's a whole bunch.
Hit me with your best nail knowledge.
All right, so there's Bowes lines.
Bowes lines, what are those?
There are these horizontal grooves that run across the nail.
Okay.
They can be caused by a recent illness or injury.
Interesting. So like a little record of your health history.
Exactly. Like a timestamp on your nail.
That's so cool.
What else?
Then there are splinter hemorrhages.
Splinter hemorrhage, tiny reddish-brown lines that look like splinters under the nail.
I think I've seen those before.
Could be from minor trauma, some medications, but sometimes they can be a sign of something more serious.
Like what?
Like endocarditis, an infection of the heart valves.
Whoa, so those tiny lines could mean big trouble.
It's always best to get them checked out, just in case.
Got it. Any other nail conditions we should be aware of?
Oh, yeah. There's an onycholysis where the nail plate separates from the nail bed.
The nail separates.
Ouch! It can happen from trauma, infection, or even a reaction to chemicals in nail polish.
Yikes. Okay, and one more.
One more. Pitting, tiny depressions or dents in the nail.
Interesting.
Often associated with psoriasis, but could be other things too.
Wow, so much to learn about nails I never knew.
It's a whole world under our fingertips.
Okay, so we've covered discoloration, vascularity, lesions, hair conditions, nail conditions. What else is there to know about the integumentary system?
Well, we haven't really talked about wounds yet.
Oh, right. Wound.
Our skin is our first line of defense. Constantly getting cuts, scrapes, burns.
Yeah, it takes a beating.
It does.
And sometimes those wounds can get pretty serious.
Absolutely. Even minor wounds can become infected.
So let's talk wound care then. How do we keep those wounds clean and happy?
First, it's helpful to understand the different types of wounds.
Okay, what are the types?
You've got acute wounds, those that heal quickly, and chronic wounds, the ones that linger.
Like those pressure ulcers we talked about before.
Exactly. And then there's primary intention healing,
Okay.
where the wound edges are brought together neatly, like a surgical incision.
So it heals nice and clean.
Right. And then there's secondary intention healing.
What's that?
That's when a wound is left open to heal from the bottom up.
Okay, I'm picturing it.
It usually leaves more noticeable scar.
Makes sense. So how do we know if a wound is infected?
Well, look for redness, swelling, pain, warmth,
Okay, the classics.
and pus, of course. Sorry. But seriously, if you see any of those signs, especially red streaks spreading from the wound,
Red streaks?
yeah, that means the infection is spreading.
Okay, that's when you definitely need to see a doctor.
Absolutely. And for those stubborn chronic wounds, there are special treatments.
Special treatments, like what?
Things like negative pressure wound therapy.
Negative pressure.
It's like a vacuum that helps draw out fluid and promote healing.
Wow, technology is amazing. So we've covered so much in this deep dive.
We have.
From discoloration to lesions, hair conditions, nail conditions, even wounds.
The integumentary system is a busy place.
It is. What a journey.
It's been a pleasure exploring it with you.
I feel like I'm seeing my own skin in a whole new light now.
That's what we hope for.
Thanks for joining us for this fascinating deep dive into the integumentary system. And as always, be sure to check out the show notes for links to resources where you can learn more.
And don't forget that sunscreen.
Until next time, keep exploring the amazing world of the human body.